All right, let's talk about some tests, some movements to try to assess whether you have some nerve tension or some, tightness in that leg. So oftentimes when you're dealing with a disc injury or something similar to like a sciatica. So sciatica is generally just a garbage pail term for any kind of pain in the leg. So what would be causing that? Let's talk about maybe identifying some tests so we can kind of figure out, is it more of a nerve tension thing or is it more of a different issue like a hamstring strain or something else? So one way that we like to look at that would be, if this is my painful side, this is my left. If I kick that leg in sitting, right? So in sitting, I'm going to kick that leg out and I'm going to make sure that I pull my toe back towards me. So as I do that, I'm tensioning that whole nerve system throughout as it comes out of the lower back, and then it splits into, so I have the nerve roots. Those roots form into a thicker nerve in the back of my leg, and then it splits in the back of my knee into a common fibular nerve and a deep tibial nerve. For the purposes of this, it doesn't matter, but we just want to see if we come this way and we pull the toes back, it's like, oh, I feel that like tension and that tightness. Another way to further sensitize the system is to go ahead and slouch and put the head down. Now you're really tugging on that nerve all the way from your neck, your brain, all the way down, okay? So compare the two sides. So the good side doesn't hurt. What do I feel over here? Maybe I just feel like some tightness or some tension. And then maybe on this side I feel like, oh, like it's a shooting, pain, which would indicate some kind of nerve tension. Another way to think about that would be in standing. If I'm just keeping my back straight and I'm bending forward in standing, which is a common thing. So if you feel like that tension is there, that pull is there with bending forward, that could be another indication of some tightness or some nerve tension on there, as opposed to maybe I bend but I have my knees bent. Maybe I don't feel that as much. Having your knees bent is a different kind of thing. Okay, sometimes another way to think of it or I use would be kind of a straight leg raise test, or again, similar principle. I'm trying to tension and lengthen that nerve. So when I bring my knees up this way, right, I'm getting some flexion, and it may or may not feel like there's anything in that leg. But if I tension and I pull that my toes back and I tighten or straighten my knee by tightening my quad, and this side maybe I feel like, oh, that's the pain I'm talking about in my calf or in my butt cheek or the hamstring. Or if I go this other side, maybe this is more just a natural kind of like stretchiness feeling. So if those are positive, you could probably use some of those motions to just go ahead and lightly, and I mean like lightly, floss that nerve. So maybe we're just kind of, start with the toes kind of pointed, and we're just going to kind of lightly pull that in and out, in and out. We don't want to tug on or like statically, stretch. Like that hamstring stretch idea for that pulling sensation back there is generally a bad idea. You don't want to stretch that hamstring with a static stretch when the nerve root itself is already irritated. So we can either lightly in and out, pressure on, pressure off, or the better idea would be to go ahead and go the other direction. So I would start right into prone, so stomach, and then you're going to lightly monitor what you feel back here, but go ahead and press up and close that side down and take the tension off. So now we're not putting any tension on it. We're shortening that, not lengthening it and putting tension on it. And as we work into extension and lying in this case, right, pressure on, pressure off, really test a good, you may only get to this high in the first one, but just slowly get further and further and further, further and further and further, and monitor what you feel back there. And we could use that first test as a good baseline to see if we're making progress. So after 10, 12, 15 reps of those, go back to that, whether it's this way or whether it's this way, go back to that same test. Now all of a sudden, after doing 10, 12, 15 reps of extension, now maybe you can get from here, now you get to here before the tension, see if that painful either area or the intensity is different, or you can do it more. Possibly you might be able to then now I can lift this leg up with only a 5 out of 10 pain, where before it was a 7 out of 10 pain. I can just compare both sides. So use those as use those tests as a test, but also use it as a baseline to see if you're making progress with any of the specific interventions that you're actually using. So my choice would be the extension first to test, and then retest the nerve tension test to see if that's any different. So hopefully that'll give you some advice there, and hopefully it'll give you some benefit.